What is motor neuron disease or ALS? Can your lifestyle put you at risk of developing motor neuron disease? Is there a cure for it? And more importantly, can we do anything to prevent developing this potentially deadly disease? Hi, in this video we'll be doing an overview of what motor neuron disease or ALS is, the signs and symptoms, its management, and how long one can expect to live once diagnosed. Stay tuned to the end as I explain whether there is a cure and what we can do regarding potential treatment. All jargon will be explained so anyone can understand this video. Motor neuron disease is a progressive disease that involves degeneration of the motor nerves and wasting of the muscles. What is the difference between motor neuron disease and ALS? Technically, ALS is the most common type of motor neuron disease, but in practice both terms are used quite interchangeably, with ALS being a more common term in America and motor neuron disease more commonly used in the UK and rest of the world. Motor neuron disease can affect anyone. It is rare under the age of 40. It usually develops between the ages of 55 and 80 and is more common in men than women. For the majority of cases, it is not inherited and it does not run in families, although some inherited patterns have been suggested. The cause of motor neuron disease is not known. It is thought that certain chemicals or structures that only occur in motor nerves are damaged in some way. The reason why the nerves become damaged is not clear. It is also not clear why sensory nerves, i.e. those nerves responsible for touch, smell, taste, which have a similar structure to the motor nerves, why they are not affected. Symptoms tend to start in the hands and feet, where the muscles tend to progressively become both stiffer and weaker. The grip can become weaker and simple things such as opening bottle tops can become troublesome. A patient with motor neuron disease may drag one leg or tend to trip easily. They may find it more difficult to climb stairs or rise out of low chairs. They may also find that they are much more tired after walking. A few of these symptoms we certainly noted in the analysis of Ultimate Warrior, who most likely had motor neuron disease, and I'll post a link to that video down below if you've not seen it. There may also be what we call in medicine bulbar symptoms. This basically means difficulty in talking and swallowing. Other symptoms may include muscle cramps, tiredness, twitching of weakened muscles, and jerking of an arm or leg whilst resting. As the disease progresses and becomes more severe, people with motor neuron disease are unable to walk, talk, or eat and need a lot of care. Many need a ventilator in the final stages to help them with their breathing. What is not affected in motor neuron disease? Typically, intellect is not affected. No greater example of this can be provided than Professor Stephen Hawking, whose achievements need no elaboration, and someone I was lucky enough to meet when I was a student at Cambridge. It should be mentioned, a minority of motor neuron disease patients may develop a very specific type of dementia. Emotional feelings and sexual desire are not directly affected by motor neuron disease. However, like with many chronic conditions, depression and anxiety may develop anyway. Sensory parts of the nervous system are not affected, so you can still feel, see, smell, taste and hear as before. Remember, the disease is motor neuron disease, so what we are talking about is motor impairment, strength, coordination and movement. Diagnosis. There is no specific test which diagnoses motor neuron disease. It is essentially a clinical diagnosis made by a specialist, a neurologist, often after carrying out various scans and tests to rule out other conditions. It can also take some time to diagnose motor neuron disease, often up to a year after onset of first symptoms, that it's not always clear what is going on, even to a specialist. Treatment. There is no cure, unfortunately, for motor neuron disease, but there are various treatment options available which can help with the symptoms experienced. Riluzole is a medication that clinical trials have shown to have a protective effect on nerves. It reduces glutamate accumulation, which has been shown to cause damage to the brain and spinal cord. With regards to feeding and swallowing issues, thickened fluids can be used or a small tube passed through the wall of the stomach. Physio and speech therapy can be beneficial, and therapeutic medications can be prescribed for cramps, difficulty swallowing, urinary issues and depression. Prognosis. The prognosis or outlook of motor neuron disease can be variable but is generally quite poor. 70% of patients with motor neuron disease are dead within 3 years of onset of symptoms, 75% within 5 years, and 95% are dead within 10 years. Having said that, there are always outliers, as with anything else. Again, Stephen Hawking is a great example of both longevity and achievement in spite of his diagnosis, which was made at the age of 21. He lived with this for over 55 years until his death at the age of 76. Can you prevent motor neuron disease? Unfortunately, because we don't know what causes motor neuron disease, we also don't know how to prevent it. The good news is there is a lot of research going on regarding motor neuron disease. You may remember a few years ago the Ice Bucket Challenge for ALS. One thing we can do, and I'll post a link down below, is to try and raise money for research, and one of the best organizations for this is MND Association. Anyway, I hope one day we have a better understanding and treatment of this quite deadly condition. I hope you found this video useful as an overview of motor neuron disease or ALS. Be sure to hit that like, subscribe and notifications button to keep learning. Any comments or questions, please post below. Any suggestions for future videos or topics, please also post below. Until next time, stay safe.